Healthcare teams are using AI to watch over patients both inside the hospital and after they go home. In this lesson, we'll look at continuous monitoring systems on hospital wards, remote patient monitoring for people at home, wearable devices like smartwatches and glucose sensors, virtual nursing programs, and AI tools built into telehealth visits. The common thread across all of these is that AI extends how far a care team's attention can reach. Instead of a nurse or doctor only knowing what's happening when they're physically checking on someone, AI systems watch data continuously and flag problems early, often before a patient would even notice something is wrong. That earlier warning is what makes these tools valuable, because in medicine, minutes and hours genuinely change outcomes. Hospital monitors have traditionally relied on simple thresholds: heart rate too high, blood pressure too low, oxygen below a set number, and an alarm goes off. The trouble is that ICU nurses can hear hundreds of these alarms in a single shift, and most of them turn out to be false or clinically meaningless. Over time, that leads to alarm fatigue, where staff become desensitized, responses slow down, and in the worst cases, a real emergency gets missed in the noise. AI changes the approach entirely. Instead of watching one number against one threshold, it looks at patterns across multiple vital signs at the same time and tracks how they change over hours, not just in the moment. That shift from single number alerts to pattern recognition across the whole picture is the foundation for everything else in this lesson. Systems from companies like Philips, GE Healthcare, EarlySense, and Bioformies analyze vital sign trends, subtle correlations between heart rate variability, breathing, and blood pressure, and how a patient's current trajectory compares to their own baseline and to others who later developed complications. The payoff is fewer but more useful alerts. Instead of 100 nuisance beeps, the clinical team might get one message: a patient in a specific room has a high probability of deteriorating in the next 4 to 6 hours based on trending vitals. Sepsis prediction is a major use case here. Sepsis is one of the leading causes of in-hospital death, and every hour of delayed treatment raises the risk. Duke Health's Sepsis Watch, a deep learning model, monitors patients in real time and has identified sepsis risk 4 to 6 hours earlier than conventional screening. The nursing shortage has pushed hospitals toward virtual nursing models, where experienced nurses monitor several patients remotely using cameras, sensors, and AI dashboards. AI supports this by prioritizing which patients need attention first, handling routine tasks like vital sign documentation and full risk checks, alerting the virtual nurse when something concerning changes, and helping bedside nurses with documentation and order reminders. It's worth being clear about what this is not. Virtual nursing doesn't replace the nurse at the bedside. It augments them, letting experienced staff extend their oversight across more patients at once, so the people doing hands-on care get back up on the routine and repetitive parts of the job. Remote patient monitoring, or RPM, takes this same idea of AI surveillance and extends it past the hospital walls. Patients use connected devices at home: blood pressure cuffs, glucose monitors, pulse oximeters, scales, and wearable sensors that stream data to a monitoring platform. AI establishes a baseline for each individual patient, detects meaningful deviations from that baseline, generates alerts for the care team, and provides trend analysis for follow-up visits. The applications are wide-ranging. In heart failure, daily weight and vital sign monitoring can catch fluid retention before it becomes severe. And studies show RPM can cut readmissions by 25 to 40%. It's also used after surgery to watch for infection or complications for chronic conditions like diabetes and COPD between office visits, and during the 30 days after discharge, which is the highest risk window for a patient to end up back in the hospital. Consumer wearables are increasingly capable of real clinical monitoring, and that's changing what patients bring into an appointment. The Apple Watch is FDA cleared for ECG recording and detecting irregular heart rhythm, and multiple studies have shown it can catch previously undiagnosed atrial fibrillation. Continuous glucose monitors from Dexcom and Abbott Freestyle Libre give real-time glucose readings that, paired with AI, help optimize insulin dosing and warn patients about dangerous glucose swings. Devices like the Oura Ring track sleep, heart rate variability, and temperature, data that AI can use to flag early signs of illness. For healthcare professionals, the real challenge isn't the technology, it's knowing how to fold this patient-generated data into clinical decisions when someone shows up with months of it already on their phone. Telehealth expanded fast during the pandemic, and AI now shows up at every stage of a virtual visit. Before the visit starts, AI can gather symptoms, review the patient's history, and prepare a clinical summary, so less time gets spent on data gathering once the provider joins the call. During the visit, AI can generate real-time documentation through ambient scribing, suggest relevant clinical questions based on what the patient describes, provide clinical decision support, and even monitor audio and video quality to make sure the connection is good enough for a real assessment. After the visit, AI can automate the follow-up work, writing visit summaries, sending patient instructions, scheduling next appointments, and starting referrals or prescriptions. Together, these tools make each part of a telehealth encounter faster without cutting corners on care. Let's pull this together. AI-powered inpatient monitoring cuts alarm fatigue by reading patterns across multiple vitals instead of single thresholds. Sepsis early warning systems can flag risk 4 to 6 hours before conventional screening catches it. Remote patient monitoring extends that surveillance into the home, and for conditions like heart failure, it can reduce readmissions by 25 to 40%. Consumer wearables are now clinical grade, which means healthcare professionals need to know how to read and use that patient-generated data. And AI touches every stage of a telehealth visit, from pre-visit triage through real-time support to post-visit automation. If you want to go deeper on any of this, head over to the lesson page on FreeAcademy.ai, where you can work through these concepts in the interactive course material and test what you've learned right in your browser.